is that different from other approaches?
The anterior hip is different than any other approach because it's truly a minimally invasive procedure. No muscles are cut. It's not so much the size of the incision, but if you go posteriorly, you cut all the posterior muscles and the gluteus maximus. And when you do that, they heal fine, but there's a certain rate of the hip popping out of the socket, and that's called dislocation.
Dr. Carter says one advantage of the direct anterior approach is that patients are less likely to have dislocation. A second advantage is that patients may rehabilitate much more rapidly and be off crutches or walkers faster than with a posterior approach.
Good afternoon, Dr. Carter. How are you doing? I'm doing great, thank you. Thanks to you. Good.
That was the experience of patient Gordon Johnson, who on this day is 17 days post-surgery.
I have other friends who've had the more traditional, I guess I would call it, hip replacement surgery. You're on a walker for 4 weeks to 5 to 6, depending on how you progress. I wasn't on a walker really a week coming out of here, and I haven't used a cane except on uneven surfaces.
How has your recovery been?
They got me up, and surprisingly, I was able to put weight on the hip, and there was no pain.
The same day as you had the surgery?
Same day I had surgery.
Were you surprised?
Yes, I was.
And where are you now?
I'm released. I'm back to driving. I move. I can put my shoes and socks on that I couldn't do before.
Dr. Carter says he now uses the direct anterior approach on every hip replacement patient he can. Are there any limitations on people once they've had hip replacement surgery?
Yes, there are limitations. We really don't want them trying to jog. They're allowed to play doubles tennis, especially with the direct anterior, because we're not so worried about this dislocation issue.
Knees are another joint that can cause a lot of pain. How are you using technology to help people get back to their active lifestyles?
Well, our current technology is to use navigation, which we've actually have been using for, I guess, about 5 years or so. We've done 600 or 700 cases with it.
The computer navigation system from Stryker Orthopedics gives doctors a sort of report card. Doctors can make their cuts based on what they see on the computer.
These are the trackers. One goes here and one goes here. We can check our cuts and we put it in. The computer, at least using the program we use, which is it's called Stryker 4.0, it is the most advanced one. It gives us what's called kinematics. So when we're done at the end of the operation, we see exactly how well aligned that knee is. This is the triathlon knee. This is the knee that we've installed.
When Dr. Doyle Leslie needed a total knee replacement, he says he looked for a doctor using computer navigation. How did you get to the point where you just finally needed knee surgery?
I was playing competitive tennis around the state in my age division.